The Philippine Nurses Association of Nevada now brings you FilipiNars. News, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer.
Welcome to FilipiNars, your new radio program, mga Filipino nurses. This radio program is brought to you by the Philippine Nurses Association of Nevada. I am your host, Doris Bauer, the current president of the PNANV. It's an exciting episode, a premiere episode, as we take you to the sights and sounds of the recent event that we did, Let's Dance to the Rhythm. This was our annual fundraising Valentine's Ball event, and as it happens, it was also the induction of the newly elected Board of Directors for 2019 to 2021. So, here's the opening report from PHLV Radio.
Local news. Vegas Pinoy Reports.
Saturday mga kababayan sa Las Vegas, even as the U.S. is still projected to have a shortage of nurses as the baby boomers age and the healthcare needs grow, there was no shortage of fun at this weekend's Let's Dance to the Rhythm Valentine's Ball by the Philippine Nurses Association of Nevada. It was held at the Orleans Hotel and Casino, and Honorable Judge Bill Henderson inducted into office the 2019 to 2021 Board of Directors. Both PNANV President Doris Bauer and President-elect Reynaldo Espina expressed joy as they welcomed nurses sa annual fundraising event na ito. The association also announced the launch of their talk show FilipiNars, a new radio program at PHLV Radio. The annual ball was hosted by multi-awarded journalist Dave Carvassier.
And yes, we did announce that night that we were launching the FilipiNars. So, folks, here we are.
You are listening to FilipiNars. News, interesting features, and events in the nursing community and beyond. From the Philippine Nurses Association of Nevada.
So recently, FilipiNars talked to the Cleveland Clinic about their research program, especially and specifically their COBRA project, which is a research for Alzheimer's, and also the Healthy Brains Initiative. This was very informative po, not only para sa mga FilipiNars, but to everyone. So, please listen in. So, hi. So for this segment of FilipiNars, we have invited two prestigious people from the Las Vegas community who will be talking about the COBRA project. And this is in regards to Alzheimer's and dementia and Parkinson's as well. So we have with us on the studio Dr. Aaron Ritter and Katura Hartley. Okay. So welcome and thank you for coming.
Thanks for having us.
Thank you.
Thank you. Okay, so Dr. Aaron Ritter is a staff physician of the Cleveland Clinic or the Lurovo Brain Center for Brain Health here in Las Vegas, as you all know. Dr. Ritter had obtained his medical degree from the University of Colorado, and then went on to have some internship in Arizona, right, Doc? Mm-hmm. Okay, and right now he is the project director or the for the clinical trials program at Cleveland Clinic. Is that correct?
Absolutely.
Okay, you have anything to add?
I would just add that at our center we're dedicated to finding more and effective treatments for Alzheimer's and Parkinson's, and we also see multiple sclerosis. We're the kind of crazy building down by the outlet mall on the north side of town, and I used to come visit Las Vegas and go to the mall, and then one day I ended up in the parking lot, and I said, what kind of museum is this place? And he said, no, this is a hospital or a doctor's office. And little did I know that a couple of years later I'd be working there and trying to solve the problem of Alzheimer's disease.
Oh, wow. It is an interesting building, and we're glad you decided to come here to Las Vegas. So,
Yes, we're very lucky.
yes, we are very lucky. And with Miss Katura Hartley, otherwise known as Kat, right?
Yes.
That's how we know her. She is an ambassador for Alzheimer's and is a project manager also at the Cleveland Clinic. And she is a pharmacist in background, correct?
Yes,
Okay.
that's correct.
Used to work for the FDA to actually involve. Well, you were involved in the development of drugs for Alzheimer's cures.
Yes, I was in the division where we approved new drug products for Alzheimer's and other neurological conditions, as well as looked at the investigational drugs and their development.
Great. Okay, so you two are a great pair. So we are here today to discuss, what you're currently doing at the Cleveland Clinic, and one that actually Alzheimer's is near and dear to my heart because my mom, passed on with Alzheimer's. So and it was very difficult for everyone. So, so tell me what you guys are doing for Alzheimer's and Parkinson's.
So we're very lucky in the city of Las Vegas to have one of the top Alzheimer's disease treatment and research facilities in the country. We've been around for 10 years, and some of the most famous neurologists have worked at our facility and have built our facility. So we're very lucky from that perspective. Things are changing with Alzheimer's disease. Everybody is at risk over the age of 65. It doesn't matter if you have a family history or not. If we're all planning to live over that age, we're at risk for developing the disease. And the purpose of our center is to both diagnose and treat patients with Alzheimer's, but also more importantly, because we don't have effective treatments that stop the disease, to find better and more effective treatments. Because right now, 5 million people in the United States have Alzheimer's disease, and 50 million people worldwide, and that number is going to balloon to 150 million people over the next 30 years.
Wow.
And most of the cases of Alzheimer's are in places where people are living longer than they've ever lived before. It's important that we find more effective treatments, and that's what we're doing.
That's great. So there is this thing called the COBRA project. Can you tell me a little bit about that?
Yes, I'll talk a little bit about the COBRA project. So it stands for a Center of Biomedical Research Excellence. So what it is a research study where we're trying to find more about the disease than we know now. So some of our research studies are testing new medicines. In the COBRA study, we're trying to find more about the disease so it eventually will lead to better medicine. So the COBRA study is a partnership between UNLV and Cleveland Clinic.
Cool.
And what we're doing is trying to build up the research infrastructure in Southern Nevada so that we can have a research presence for solving Alzheimer's disease in Nevada. That hadn't been the case before. Most people would have to travel to San Francisco or Los Angeles or New York City to be involved in research. And the COBRA is about bringing research to our state, having our scientists work on it, and having the opportunity for the people of Southern Nevada to contribute to finding a cure. So we're doing a study where we're following people with Parkinson's and Alzheimer's for 5 years and trying to understand how the disease changes in the brain. We do brain scans and blood work and things of that nature. And it's a real nice collaboration between the Cleveland Clinic and UNLV. So it's been a really exciting program. We've had more than 150 people enrolled, and our goal is to have 150 people stay in the study for 15 years.
Wow, that is wonderful. And I'm excited really that we used to turn to other big cities for centers of excellence, and to San Francisco, to New York or whatnot. Now we have a center of excellence right here in our state, and the study that you're doing is benefiting not only the whole world, but primarily for the Nevadans, right?
Absolutely.
Oh, that's wonderful. That's great. Okay, so how can you explain the process of how you're going to achieve the goals that you're doing? How are you getting participants?
Well, I mean, that's where Kat comes in. She's been really, really instrumental in helping us recruit patients. It's scary, the idea of being in a research study. If you've never done it before, you don't know what goes into it. It can be a little bit frightening about joining a study. And what our goal in Nevada is, with our study, is to reflect the diversity of our city. So if only a certain type of people participate in research, we don't know if we can use those results for all people. So we want a cure for Alzheimer's disease to be able to be effective for all different types of people. And in our study, it's unique where we're trying to replicate the amount of people with different racial and ethnic diversities to participate in our study. And so it's been really instrumental to get all different types of people to participate. The history of Alzheimer's disease research is that 90% of folks that have participated in studies and 95% that have participated in drug studies are white Caucasian people. And that limits the results. We don't know if it will work in other countries. So our goal is to say that's not right. That's not how we should be doing research. So our goal is to reflect the greater diversity of Las Vegas. We have such a diverse community to draw on all people to help us participate. And for us, that can be a challenge because we have to educate people about what it's like to be in research, what it's like to be diagnosed with a disease like Parkinson's or Alzheimer's. And that's where Kat comes in, and she's done a great job educating the community about these common neurologic diseases. I think for a long time, the sense was, why be diagnosed? There's no purpose. There's no treatment. That's changed over the past 20 years. And as we get closer to finding more effective treatments, it's really important for early diagnosis and treatment and management. So things have changed. It's a shift in the paradigm of how we think about these neurologic diseases. And it's scary, and it takes a long time, and it takes a lot of education. And that's where we're so lucky to have someone like you having us on this program and having Kat go out there and educate people about these different diseases.
So that's so great. I know that Las Vegas is a very, very diverse community, and so I would like to ask you, Kat. So how do you go about trying to educate people and make them aware of our issues, our problems, and how to participate in the study?
I really do think it's important for people to learn more about dementia and Alzheimer's and kind of break down some of the stigma that may be associated and the fears associated with these diseases. And so I spend a lot of time at actually community health fairs. I do presentations and deep dive into the community to even let people know that our center exists, the Lou Center exists. Not only is there treatment there, there's education and other resources available for our community. And then to bring up the research conversation. This is a great way if, say, you had a family member in the past. It's a way to give back. It's a way to feel like you're doing something for the future. So I do spend a lot of time in the community and getting to know people, finding people like yourself. That helps us find other people. It's sort of, we try to connect the dots.
Yeah, and because of the diversity of the population, you have to also consider that each ethnic group have their own values, with regards to research or medical issues and things like that. So I imagine that's a big challenge.
It is a big challenge, and a lot of there's been a lot of bad history, with research, and it's a very scary word for some people, and they shy away. But we find over time, if you can kind of educate and make them understand the benefits to society and to maybe help helping find cures. That's why it's important, and that it creates more health disparities if certain populations are not participating in research as well.
That's correct. So what is your goal with regards to percentages for ethnic groups? Have you met them, or do you have any numbers that you can share, or Maybe
Sure.
not,
Yeah. So the study has been running for about 3 years. So we've
Right.
had, our goal is 15 years to
15
be
years,
following
right.
people,
Uh-huh.
and right now we're at 3 years, and we're at the point where we're analyzing how well we're doing,
Mm-hmm.
and the percentage that we've done really well with is the Asian community. We've actually done really well.
Yeah, very good.
Excellent. We've done well with Hawaiian folks as well, and we've recruited well for our African American group. Our goal is about 12% of African Americans, and we have a 10%. So we're getting there. The groups that we've had a little bit more difficulty with, I think, are folks from Hispanic backgrounds. Part of our challenge is the testing materials. The tests we're doing are not always in Spanish; they're in English, and sometimes that could be a challenge. And then our Native American colleagues, it's been difficult to recruit for that group as well.
That is difficult.
So we're making progress, and part of this is just getting the word out and educating and recognizing that the way different cultures view aging is completely different.
Right.
And we want to take that into consideration as we're running studies and as we're caring for patients as well. I do think it's worth mentioning that our center is a Medicare facility. It doesn't look like it, but it is. We're open to all patients in Las Vegas. We want and Medicaid as well, and we want to bring that approach to saying we don't want to change how a person is dealt with, but we want to give them medical information about their aging process. That's my goal as a person that treats cognitive disorders, to say, this is medically what's going to change. I don't want to change how you treat this person, but this is what we know medically is going on in their brain. And we want to bring that approach to our research study as well.
Well, I am so glad that you did mention that the Cleveland Clinic is a Medicare Medicaid center, because there's a lot of patients that I talk to, and I say, well, why don't you, if they say they have a neurological issue or some other kind of issue that you guys can help with, they say, you got to have big bucks to go over there. And that is a misconception, I think, in this community.
Well, I comment about it's a brilliant design. So
It is.
Mr. Ruvo is the philanthropist, the benefactory of the facility. His father developed and died from Alzheimer's disease, and he couldn't get care here. So his goal was to bring something to Las Vegas, and he had a brilliant idea: is if you build something neat, people can use the facility after hours to host conferences, host weddings and events like that. So the purpose of the building is to draw people to be there, to use the facility at nighttime, and that can support the clinical operation. So I think what's unique about our place is we get to spend more time with patients, because these are challenging issues that can't just be done in a 5-minute conversation. And so the idea behind the building is really a unique idea, but it's not that the patients themselves have built this facility or supporting the facility. That already existed. Our goal is that we can spend as much time and care for patients as much as we can. All of their social services at the center are free, no charge, and that's not typically what we see at other places that care for people with Alzheimer's.
Right. So how can we, as part of the clinical community, help in disseminating information and asking people to participate in your research? And could you?
Yes. Well, we need all the help we can get always to get out of the word in the community that we are here to serve everyone. And the best entry we have right now for our research actually is our Healthy Brains initiative. It's an online tool to educate the public about brain health and lifestyle factors that impact brain health. But as well, it works as a research registry. And it works as a communication tool for us to be engaged with people who may just kind of be interested in research or want to learn more about it. But it puts people in a community pool where we can email you and let you know about research that may be going on. And I'd like to point out that sometimes we need healthy controls.
Oh,
We need
yes.
people of the same age who are not having any cognitive issues to participate in our research as well.
That's great. So
Yes.
you have a website then? Can you share with us
Yes.
how to get into it?
Sure, on healthybrains.org. It's Cleveland Clinic healthybrains.org. You can go online, and there's a blue button there that you can take a brain health checkup. And it's designed to educate you about what you should be eating and how much exercise, how much you're sleeping, how these things impact your brain health. We give you a personalized brain health report and tips on how to improve. But then also there's an ability to say you're interested in research. And when you say
okay.
check that box, you're in our pool of people that we could possibly email when there's a trial or a short clinical research project we need help with. And then we also keep people aware of events and things happening at the center.
Great. Okay. So that's good. You said there is a brain checkup. What does this assessment entail, and who would you recommend to take the brain checkup?
Well, anybody with a brain qualifies for the brain health checkup. All right, so I'll let the listeners decide if they qualify. I always make that joke when I go to Washington D.C. for funding. Anyone qualifies, assuming you have a brain. Yeah, so
There's no one in Washington D.C. without a brain, is there?
So yes, and we have what we call the 6 pillars of brain health.
Right.
And we kind of have a deep dive into that. And it's a great educational tool for both professionals to use as well as younger people. We've had all ages and walks of life to use. And it's a quick, easy entry into research, actually. All you need is an email, actually, and your first name. Yes.
That's good. That's good. So
Can I just want to add, so if a patient comes to see me and says, I have multiple family members, my grandfather, my father, whatever it is, have been affected by Alzheimer's disease.
Right.
What they say, what can I do? What can I take to prevent this? And we don't have an answer for that. We don't have a medicine. We're working on that. We think maybe one day we'll be able to give a medicine to somebody, so this will prevent you from getting the disease. But we're not there. We do have really strong evidence and research that backs it, that says many cases of Alzheimer's are preventable. And the Healthy Brains and the Brain Health Guide that goes along with Healthy Brains takes all those things together and gives you a personalized score based on your risk for developing the disease. And we think that this is a very effective tool that can be implemented at any time in your life if you're going to live over the age of 65.
Right.
These are the good things. These are 6 things that you can implement at any point in your life, and we think can reduce your risk of developing dementia. And I think if you're interested in prevention, if you want to keep all these important memories that we have in our brain, that I think you should start today on Healthy Brains.
And I quote from your the internet. It says, quoting from you, that Healthy Brains is a roadmap that we can use to accomplish the important goal of helping. Is that correct?
Yes.
Well, I got that right.
It's really kind of fun. It's really easy to do, and it gives you simple tips. If you go to the supplement store and you see on TV, you see all these advertisements about these different supplements. There's no proof that these supplements prevent Alzheimer's disease. But we have really good, strong evidence that lifestyle changes that are implemented as early as possible can reduce your risk.
That's true. I saw a segment on TV the other day about this lady who used to be a big corporate person, and she found music as it helps her with remembering Alzheimer's. So, things like that emanate from research. And so
Absolutely.
I'm so glad. So how can you, what is your commitment? I'm sorry, Kat.
I was going to say we actually have a music therapy program at our center, and it is open to the public.
Wow.
So we have a lot of programs and services that we try to offer to our community as much as possible. between Wednesday lunch and learns and caregiver support classes. So we have a wealth of information. We have a library where you can access a lot of that.
People need to know these things. Because,
And they're welcome to come, yes.
Right. Well, I'm glad we could be part of disseminating this info. So what is the commitment if, say, I want to be in your research or somebody, what is the commitment and what would I do to participate?
So being in a research study is not much different than having a normal visit to the doctors. The first part of any research study is to do what's called a screening, where we make sure you're a good candidate to be helped or to contribute to the research. So there's always a visit where you meet with a study physician, and we talk about why you want to enroll, why you're doing it, and we go over in detail everything that's involved. So before we would even do any sort of research at all, a person has to know all the steps that are involved. So that's the first part.
Right.
And then it sort of depends on the study that you're involved in. For example, in the COBRI study, we require 3 to 4 visits a year. So that's it.
That's not bad.
No, yeah, it's each of the visits about 3 hours long, and so that we do brain scans, we do memory testing, we do blood work. So it's like going to a regular doctor's visit, checking up for your neurologic system. So that's just one study. We have a bunch of different other types of studies, and it sort of depends on the study what would be involved. In general, and I think just about every study we've ever done at the Brain Center, you don't change your medicines. You stay on your medicines.
Okay.
And as Kat mentioned before, some of our studies, we're testing new medicines where we're seeing if they work, presenting them to the FDA to prove that they're helpful. And then other studies we have where we're just learning about the disease and aging process. So in the COBRI study, we're not giving medicines, but we're trying to understand how aging is going on in different patient populations, and what's different about a person that develops Alzheimer's versus somebody that develops Parkinson's versus somebody that lives healthy. And so each study is a little bit different, but it really is not much different than going to a regular visit. There's nothing different that we wouldn't do part of a regular visit. The time commitment is a little bit longer than a normal visit, but it's I don't think excessive. Most people have come back. They've enjoyed their experience, and they found it to be very helpful, and we're grateful for people that want to participate in research. I think the thing to think about when we talk about research is if we ever find a cure, the first person to be cured of Alzheimer's will be done in a research study. So that first person has to come from research.
Yeah, that's pretty fair.
Yeah, but if you think about it, it's not always obvious. But the first person if we ever cure Alzheimer's disease, and I think we will, or we'll be able to stop the disease, will be in a research study. Right now, there's no one that's ever survived Alzheimer's disease. It's a chronic disease.
That's true.
And so that it's really important. And so when you participate in research, you're not only potentially helping yourself or learning a little bit about your own brain, but you're contributing to the society at large. So it's a real way to contribute to human society, because it's a disease that we have to get rid of.
Right, and specifically also for your ethnicity and your culture. So that's
absolutely.
I like that. I really like that. So what are the age ranges that you're looking for your research?
For our research, in this study in particular, we're generally looking for people over the age of 60, all the way up to age 90.
Okay.
And so a wide range of people, both men and women, are eligible to participate. The interesting thing about all our research studies, it requires a study partner, somebody to come and talk a little bit about their observations. Because sometimes when it comes to Alzheimer's disease or memory loss in general, people themselves don't realize it. They have to have their spouse or their family member or even a friend to come and say, well, I think the memory has changed a little bit, or I'm noticing that, the things that they used to be able to do, they're not doing as well. So we do need a study partner.
Yeah.
Other than that, we're looking for people that have been diagnosed with Alzheimer's or Parkinson's. And then again, occasionally we often ask for people that are aging normally, that have no problems. And that's an important patient population for us too, because it's a comparison to say this person is aging healthy, and then what's different about this person's brain that has Alzheimer's disease? What different things did they do in their life?
Yeah.
What's different about their family history? What's different about the things that they've done? Have they, learned a new? Did they learn an instrument? Did they learn a different language? Did they work their whole life? So those interesting things that may all play a role in when this disease strikes.
Right. That's great. So we're learning a lot today. Okay. So in a research project like yours, what type of staff do you need? Do you have nurses in your staff? And specifically, since this is a FilipiNars, do you have Filipino nurses in your staff?
We do.
And what do they do?
We do. We have several Filipino nurses on our
Awesome.
team, and they do a great job. We have a model at our center where the nurses are called care coordinators. So they're all nurse. They've all been board certified nurses, but they do the coordination because that's what nurses are good for. That's what nurses are
Yes,
better.
that's where we rock.
You know the medicines, you know how people take them, you know the side effects. And so our nurses at our center are the keys in the cog of managing patients. So they really get a chance to focus on managing symptoms, education, coordinating care. And it's a really challenging and difficult job. And it's something that the nurses at our center do a great job. And we're very lucky to have them. And they do things that as physicians we're not trained at doing, we're not good at doing, and so it's a really nice model that the Cleveland Clinic has created about care coordination. So we're very lucky to have our nurses.
Thank you. And the nurses are pretty much, the key to healthcare, I should say. I don't know. Physicians are good too, but
I got to tell you.
Just
Can I tell you?
kidding.
I would tell you a funny. So I'll tell you a funny story about medical school. So I was in medical school, and they said, "Well, used to be a doctor would draw the blood. That is. I don't think that happens anywhere. But they said, well, we got to teach you guys in case you're doing, something you have to draw blood. We teach you how to do it. 4th year medical school. How to use the tubing and all the different gauges and all this stuff is the hardest part of medical school, learning all the different things. And nurses does it with her eyes closed, talking on the phone. And so we go around and they say, we're going to draw blood on each other. I said, that's fine. I get blood all the time. So I started drawing blood, and we started. 4, 5, 6 people fainted in my medical school class. I said, you didn't realize you guys are going to medical school. You're falling. I had to bring the nurses in to help take care of the doctors.
Oh my gosh, yeah.
So that was that's when you say, and stay in your lane, doctors, with the blood and drawing blood and things of that nature. So I really appreciate that's a firsthand knowledge of how important our working together is. And
that is true. That is true. And mutual respect with each other as well. Are there any preventative measures that you can suggest right now? You said there's not really that much for Alzheimer's or anything.
There's
nothing really.
There's no medicines.
Right now? Medicines.
There's no medicines, but we know that a certain percentage in the percentage changes. It sort of depends on the study, but we think that up to 2 million to 4 million cases worldwide of Alzheimer's could be prevented by lifestyle changes that are in healthy brains. But there's no medicines. You can go on TV, you can go to GNC and see things that say this is for Alzheimer's or prevention, and we see them in the newspaper all the time.
Right.
But nothing has been proven. The only thing that has been shown are the lifestyle changes that are laid out in healthy brains. So there's many reasons why to go to healthy brains.
That's good. So everyone who are listening, go to healthybrains.org. And I actually went and visited your site, and it's pretty awesome. So everyone, I'm encouraging you to do that. And Kat, I know you've had a lot of in your family or people involved with Alzheimer's. What is your advice for those people who have cared for people with Alzheimer's like me. I was devastated with my mom, couldn't help her or anything. It was very difficult to find her a place to stay. So are there any available programs, that would help these caregivers?
Oh, absolutely. I'm same as you. I've had 6 people in my family with Alzheimer's or some form of dementia, my grandparents and my father and uncles. And had I had a center like the Lou Ruvo Center, I feel like the story would have been so different. We were lost. We didn't have places for care, long-term care. We didn't know what we were doing. And when I see the care that's given at somewhere like the Lou Ruvo Center, it's pretty amazing. And I can see how much it makes a difference in the family because we do treat not just the patients, but we treat the whole family.
Correct.
And we have so many free services available to help support caregivers because it's a really tough job, caregiving for someone with Alzheimer's disease. So my advice is if you see a problem, I would find out early and try to go seek help, really good help. Earlier the better.
That's good.
Yes. And I can't emphasize the care that we give to the whole family that can really make a difference in planning and all sorts of those big roadblocks, those things that you have to face as a family for caring for someone with dementia.
So what is a website where anybody can find, the different programs available for the public at the Cleveland Clinic?
The Cleveland Clinic Nevada is a website as well. There's some on Keep Memory Alive as well. I do encourage, I really want our public to come down and see us. So I would visit our library during working hours. We have normal business hours, and then we have lunch and learns on Wednesday at noon. And it's a great time to kind of familiarize yourself with our facility as well.
Oh, I just had an idea. We have a sort of a community event, in the Philippine Asian community. Maybe we can have these lunch and learns, posted in our community events.
Yes, we would love that.
Oh, that would be great.
Yes.
I think we know people like that. So that we can include that in there.
And you don't have to be a patient to take advantage of our educational and social services.
Right.
Yes.
Because there's some insurances we don't accept, unfortunately. But all our social services are open to the public. I would mention this when I see patients with Alzheimer's and dementia. We spend a long time with the caregiver. There's been studies that have shown that 60% of the time the caregiver dies first.
Oh.
When it comes to dementing
True.
illness. And it's really important for anybody that's doing any caregiving that they take time to focus on their own mental and physical health.
That's right. That's correct.
Absolutely. And that's so important because if the caregiver happens to get sick, there's no one to take care of the patient. It becomes a very difficult situation. So I keep that in mind. And I think that maybe is underemphasized by physicians when they're seeing patients, that they focus so much on the neurologic disease that the patient may have. But it doesn't matter if there's not somebody to take care of the patient. Everybody with these illnesses needs somebody to help with them. And so it's important that we focus on those folks. And Miss Ruvo, Camille Ruvo, this has been her passion to bring social services free to the community. And it's just amazing what they've built at our center and to take advantage of that if you are caring with somebody with dementia.
Yes, and that was my challenge, and I'm sure, Kat, that was your challenge as well. But I'm so glad that your programs actually encompass taking care of the caregivers as well, and also the patients. So, well, that was really fun. I mean, that was very informative. And do you have any parting words for now? Closing words?
Well, I think first, thanks, Doris, for having us so much. We really appreciate it. We're very passionate about what we do, as you see. And our goal, I think, is, lots of people move to Nevada because we have got a great city and we've got a great state to live in. And we have one of the fastest growing states in the country. We also have one of the fastest growing rates of Alzheimer's disease.
Wow.
Only Arizona has a faster rate of Alzheimer's disease.
I didn't know that.
Yeah.
Cool.
That's because primarily people want to move here and live in the nice city that we have here, that with our nice weather and other things that we have advantage to do here. And then one of the things I think that's going to be the draw is that we have the center here to take care of people with Alzheimer's, and hopefully one day to find more effective treatments to be able to help caregivers that are dealing with this disease and manage these patients, because this is something that we're going to continue to see. If you're a surgical nurse, if you're a nurse in dermatology, if you're a caregiver or a care provider in any field, orthopedics, you're going to see people with dementia, and it's going to become more common as the years go by. So being able to educate not only our healthcare providers, but also people about dementia in general is our mission here. And then also to do research to advance the field, because we're not happy with where we are within the field. We need to find more effective and better treatments and slow down or stop this or even prevent this disease. And that's what we're doing here. And I think a lot of people don't even realize that in Las Vegas we have a center like this. And we're so lucky to work there and spread the word about this place.
Yes, and I'm happy to do that. And I'm happy to do that I've been passionate about this thing and that's one of the reasons why I invited you guys to join our program. And so, Kat, any parting words?
Well, thank you for your service that you're providing to our community and our nurses. It's very vital, and thank you for helping us understand how to better communicate and spread education and awareness about research and the wonderful work that we're doing. We need community members to support us and vice versa, that we learn from one another, so we really can tackle this tough issue of Alzheimer's. And I know you have an event coming up, right?
Yes, we do.
Yes, and guess what? Dancing is great for your brain health.
Oh, wow. Yeah, we have an event on Saturday, and that's it's called Dance the Rhythm, and basically Filipinos love to dance. It's our annual fundraising for our organization, but we sort of equated that a lot of things change in healthcare. Caregivers, the people that make decisions, the policies, the regulations, and all of that. And so, but basically, it's a dancing thing. It's a partnership, so you have to finish the dance in, different partners, and to finish the dance, and that would be the outcome is to, positive outcome for the patient, as well as to finish the dance for a positive outcome for the patient. So that's, and for those we serve, actually. Yes. So I do thank you again, Dr. Ritter, for coming, and Kat for coming to grace our program. And so all of you out there that are listening, go to the Cleveland Clinic website, and also go to the Healthy Brains website to find out more about the different programs that are available for all of you guys out there here in Nevada, and to participate in the research as well as to educate yourself on brain health.
You are listening to FilipiNars. News, interesting features, and events in the nursing community and beyond. From the Philippine Nurses Association of Nevada.
We will have more interesting features like that. Interview with the Cleveland Clinic here at your new radio program from the Philippine Nurses Association of Nevada. It's called FilipiNars. This will be broadcasted every Friday at 7 p.m. at PHLV Radio. Listen via the free app or subscribe to our free podcast at iTunes, iHeartRadio, or Spotify, so you can listen in anytime, anywhere. Before we close, I'd like to thank the newly elected Board of Directors of the Philippine Nurses Association, and also the outgoing Board of Directors, for their hard work and dedication to this organization. Maraming salamat sa inyo. And thank you also to our families, our friends who have helped us in all our endeavors, specifically our husbands and our children. So maraming salamat sa inyong lahat. We will be looking forward to be talking to you over the radio. So this is your host, For FilipiNars, Doris Bauer signing off for now.
The Philippine Nurses Association of Nevada has just brought you FilipiNars. News, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer. Fridays, 7 p.m. Pacific on PHLV Radio.